I want to turn now to more on the fight against the virus and that breaking news in the race to vaccinate. Oxford AstraZeneca releasing data from their U.S. trial saying it's 79% effective against symptomatic COVID-19 and 100% effective against hospitalization. Let's bring in Dr. Jen Ashton. Joins us now with the potential fourth shot we could get here in the U.S., Dr. Ashton. So people hear 79% efficacy. What do we make of it?
Well, TJ, I mean, as we've been saying from the beginning, different data endpoints will have different numbers, and people shouldn't necessarily get bogged down in the number that they hear in a headline. It's really the deep dive that's important. When you hear 100% effective against preventing hospitalizations, that's a big deal. That's going to save lives. That's going to help the population where this vaccine is given. But remember, how things play out in other countries, in other parts of the world, important, but we do things differently here. And to get FDA authorization, FDA approval, that is considered the global gold standard. So we have to look at the data under a microscope, and there are still a lot of gaps and unanswered questions in terms of this particular vaccine.
Okay, those questions, and you mentioned other countries, Dr. Ashton. Some countries stopped using this vaccine, didn't want it because of concerns about blood clots. So now with this new report out about this trial, is that going to boost confidence globally about it?
Well, only time will tell, TJ. I mean, right now they're saying they have seen 0 significant severe side effects in clinical trials. When we've been following the clotting issue concerns in Europe and other countries, we have to remember that concept of background events. People will have clots, heart attacks, strokes in the general population every single day. Some of those will occur in people who have just gotten the vaccine because we're seeing more and more people get vaccinated. It's only if those events go up above the background rate that there's a safety signal. And right now there's been no evidence of that, but we will be looking at that very, very closely.
And President Biden has already said there will be enough vaccine for everyone here in the U.S., every adult. That's with the 3 vaccines we have approved. This is a 4th. Is this new data really going to make a difference if we get a 4th one in the pipeline?
TJ, some people are saying no, because if it gets authorization here in the U.S., by the time that goes through, we may already have, in fact, we are projected to already have enough vaccines for every single adult in the U.S. So there are still a lot of unanswered questions here that we'll be following in the future.
Of course, Dr. Ashton, thank you so much. I'll see you on TV later.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.